right, I'm going to get started here as we are just a minute or two behind. So good afternoon, everyone, and welcome to part 3 of the Simplified Cost Analysis webinar series hosted by HCET. My name is Megan Arias, and I am the training manager at HCET and will be facilitating the webinar today. And as a reminder, all 3 of these webinars, part 1 and part 2, are located on our website. And this one is also recorded, and I know there were a few questions about recordings, so those will be available within the next week for you to be able to go back and watch. And so now let me introduce you to healthcare education and training. HCET's mission is to provide comprehensive program development, education, and training to improve reproductive and sexual health outcomes. And HCET is an organization of passionate people who are proactive in their belief that access to evidence-based, medically accurate reproductive and sexual health education, training, and care is a fundamental right. And this webinar has closed captions available. And to enable those, you're gonna click on the live transcript button at the bottom of your screen and then click Show Subtitles. And you can change the settings by clicking Subtitle Settings. And for more information and to keep up to date with HCET events, please be sure to follow HCET on these various social media platforms and visit our website. So now I'll quickly review some housekeeping information. A link to an event evaluation will be sent to you in the chat at the end of this webinar, as well as in an email following the webinar. And your feedback is greatly appreciated. And you will also find in that follow-up email evaluations to part 1 and part 2 of this webinar series. And you can find our archived presentations and a list of upcoming events on our website. And if you have any technical difficulties during this presentation, please contact updates@hcet.org, which is the email listed on your screen. The presenter does not disclose any actual, potential, or perceived conflicts of interest. And so throughout the presentation, we encourage you to send questions via the Q&A box or the chat. And to do so, you're going to hover over the main screen, and then the icon for Q&A and chat is available at the bottom of your screen. And once you click on it, a box should appear on your screen. And you can send a question at any time during the presentation, but we will be waiting till that last 15 minutes or so to read and answer all those questions. Next slide, please. Thank you. So now I'll be introducing the presenter for today's webinar, Ginger Avery. Ginger Avery has over 25 years of experience in the healthcare industry. Ginger and the RT Welter team perform documentation quality and coding compliance audits, as well as creating and delivering customized clinician and coder trainings. She has spent multiple hours working closely with clinicians, practices, and organizations across the country on projects aimed at improving the use and quality delivered by electronic medical record programs by assisting the issues that directly and indirectly affect the reimbursement and CMS compliance. So without further ado, I will pass things over to Ginger.
Thank you, Megan, for that great introduction, and thank you to HCET for facilitating this training opportunity today. As Megan said, my name is Ginger Avery, and it is my pleasure to deliver this training to you today. This is part 3 of our 3-part series on the cost setting analysis. And on the line with us today is another member of the RT Welter team that I would like to introduce you to. Her name is Sheila Haynes, and she will be the one facilitating the training assistance that you will be reaching out for while you're conducting your cost setting analysis over the next couple of months. So please be aware that Sheila is going to be your contact. Her contact information is at the end of this webinar, and she's excited to help assist with this unique project. So as we get going today, I'd like to take a look here at our agenda. You can see it seems like with each webinar we have, they kind of build upon each other, and we have a lot to go over today. The recaps, I'll probably go through maybe a little bit quickly. If there's any questions, again, please feel free to enter those into the chat. We'll monitor them and answer questions at the end of the session. But you can see we'll be doing this recap. And then today we're really going to be putting all the pieces of this puzzle together on the tool that's been provided, and we'll be talking about the final results and how we can utilize that information to negotiate with our health plans. What does this information mean about our current fees and where we need to set our future rates? And so we will also be going over some FAQs. At least we have some slides on here that are collecting the current FAQs that we've had in relationship to this project. So know that those details are included in this training material for your reference. So here we are taking a look at our timeline today. And today, of course, is the 4th. Believe it or not. And we are at webinar 3, where we're looking at the final development of really putting all these pieces together and seeing what we can do with this information that we have collected. Now, of course, as we look at our timeline, after today is when if you haven't already, some of you may have already started on some of these activities that we've discussed. But again, now it will be your opportunity to start analyzing these details, collecting the data that we have discussed, and then reaching out for that technical assistance through RT Welter when needed. And I recommend that you work on this project a little bit. If you have no clue really where to start, even after watching these, then maybe you should get that scheduled sooner rather than later. Or perhaps you have kind of an idea of what we're sharing here. You're collecting these details and information in your reports. And maybe put it all together and start to collect your thoughts and questions so that you can make really good use of that 1 hour time that you'll have with Sheila to go over your cost setting activities. So of course, on this slide, we see that conducting a cost setting analysis is a requirement every 3 years for being part of the Title X Family Planning Program. It's important to know as we think about this as the funding for the Title X Cost Setting Project is supported by the Office of Population Affairs of the U.S. Department of Health and Human Services as part of a financial assistance award that totaled a little over $3.9 million with 100% funded by OPA, OASH, and HHS. The contents of those are those of the authors and do not necessarily represent the official views nor an endorsement by the OPA, OASH, HHS, or the US government. So for more information on those details, you could take a look at the opa.hhs.gov's website. So this slide just shares that recap of what we went over through our cost evaluation in Part 1 series, where we were really taking a look at learning about the worksheet and then also understanding how to collect our expenses for our Title X Family Planning Program, and then how do we allocate those details into this worksheet to be able to analyze our fees. We also learned about the summary report that you'll be filling out as you go through these activities. That's one of those forms that's due at this submission. And then of course, as a reminder, we've provided a fact sheet. We've got some information that's been shared by Badger Care, just to really help with everyone's understanding of these project details. So again, if you haven't already, it's going to be a great time to start looking at your expenses for the year that you've chosen to analyze and start collecting those details into your worksheet. Now, as we take a look at the recap for Part 2 that was delivered last week, we went over a lot of information. I really think that we could have probably spent an hour just looking at fee schedules. And remember last week when I shared with you that I had already put in the RVU data for you from the CMS's fee schedule. So that is a huge step in the right direction, but now we need to recognize what other details need to be collected here. How do we, find those productivity reports where we need to indicate the volume of our services on this sheet? Where do we put that and start gathering those things? Are all good questions. And of course, you can see here this screenshot of the user guide as we were diving into the Medicaid fee schedule for Wisconsin. we can definitely get into some rabbit holes. So I think one of the best lessons from last week is really learn what fee schedule is appropriate for your contract and your setting. There are a lot of them to filter through on the Wisconsin website, but this user guide should help you navigate through some of those details. And it's my hope that each clinic has a copy of their Medicaid contract that can clarify some of those details and guide you to the appropriate Medicaid fee schedule. Gosh, if my memory serves me right, I'm going to look here. We have a slide at the end of this presentation. It's slide 31 that actually has more information about how to obtain your specific details on the Medicaid fee schedule. So that is there for your reference. Okay, so now this next slide, of course, is about the recap of our service analysis details that we went through last year. And what I'd like to do here for just a moment, I'm going to switch over to the spreadsheet itself that contains some sample data. So I'm just going to kind of recap some of the columns, what these things mean. And then, of course, we need to talk about columns J and K here that include our cost of living adjustment. And where does that come from? So as we take a look here, in column C, as we recall from last week, this is where we put that data that we have discovered from our reporting features about how often we provided this service for this said time frame. So if we're looking at services for 2020, how many times did we provide in 11981 during that time frame? So that's where we input this information. Now, we can see that it's starting to calculate the value of our services because of our expense data that's been put in there, our RVU data that is with the current Medicare fee schedule that helps to allocate these things. So it'll start to drive these results that we see here on tab 6 of our clinical worksheet. So there's that service utilization that we talked about in column C. So we want to make sure that you're familiar with how to pull that report out of your system in order to get those details. Of course, column I is pretty self-explanatory. Put your current fees in here for the services that you're providing. And then column M, remember we were talking about that Medicaid reimbursement. I think this is going to be a very valuable value or consideration when we're looking at the volume to value ratio and where do we really want to set our fees. Now, again, as we get all these details lined out on this spreadsheet, there's going to be a lot of things that we want to take into consideration that are unique to our setting. Remember last week we talked about what is your patient population, what does their payer mix look like? Do you have 80, maybe 70 to 80%, a very high percentage of Medicaid patients, and then the rest are on a sliding fee scale? Or do you actually have some contracts with Anthem Blue Cross Blue Shield, and maybe that's covering 10 to 15% of your patient population. So those types of things that are occurring within your environment, the acuity of your patient population, the payer mix of your patient population is definitely going to impact where we end up with when we decide, okay, this is our proposed fee. This is where we really want to set our fees now and calculate our sliding fee scale off of these fees, which then we would consider our current fees. So again, keep those things in mind. We also talked about column N here, where it's about those commercial payers. So again, if you do have a commercial payer mix, maybe this is an average of your commercial payers. Maybe you have 3 of them that you really, want to focus on and look at those rates. If you wanted to, you could look at all 3 of them differently, or you could combine them and get an average to really give you a better idea of where your current third-party reimbursement is sitting. So not everyone will be doing that. Again, you might be fully Medicaid and sliding fee scales. But again, think about your patient population as you're compiling these details. And if you have contracts with commercial payers, you should be able to reference that contract and find your fee schedule within that contract to help satisfy the details needed to enter into column N. So just keep that in mind as we're getting all of these details here collected. One other thing that we didn't talk about last week that I think is important to talk about is the cost of living margin that COLA margin. And this definitely impacts what are adjustments that we see here in column J and K. We have this cost of living adjustment. Maybe it costs a lot less to live in Wisconsin than it does in Colorado. I suspect it does. So we're going to see a little bit of a different cost of living adjustment, maybe that's in relationship to that. Now, the cost of living adjustment rate for 2021 is 1.3%. And so that is really probably what should be populated right here in cell C81 is 1.3%. Now watch, you'll see these columns J and K shift according to that, and we start to see this cost of living adjustment reflect what is true to your current state settings. So keep that in mind as you are filling out those details. You can see in these pink cells here, that is information that's coming over from the cost report that's either in tab 3 or tab 4 here on the worksheet. So know that once you get those details put into there, that they should then, let me see if I've got a formula in here. Yes, it'll auto-populate. So just keep those things in mind as we're taking a look at this data. So now that we know that all of the data that we need to collect, where the data needs to go, and how that starts to reflect the volume to value with what we've got going on with our family planning program, then we're ready. We're ready to set our sliding fee. So let me switch back over here to our PowerPoint. And on this next slide, you can see that once you've completed all of these details that we went through in part 1 and part 2 of your cost service analysis, now we can develop your fee schedules, right? Your fee schedule rates. So now the goal was to come up with that proposed fee. This is going to be our current fee, right? So as we think about that, we want that to analyze these details, determine the structure, and then finalize our fee schedule rates. Now, one thing that I think is important to remember as I start to share the next few slides with you is that I have not provided you a template for creating your sliding fee schedule. It's generally done in an Excel file. If I would have been smart about this, I probably would have created another tab in the workbook and provided like a little sample there for you to start working with your data. But I am confident that everyone on this meeting is capable of doing that within the workbook. I suggest putting it in a workbook so that everything is collected in the same place and you have all of your details right there at easy access. So again, I recommend creating an additional tab. Let me go over here to the workbook for a second. We've got a lot of formulas and a lot of things driving stuff in here, but that's okay. I mean, you just need to say, okay, here is my fee schedule. So what you could actually do is, let me rename this. Here, I'll just do this, sliding fee scale. And so then as we go through the next few slides, I just want you to know that you can develop this in here if you don't have a foundational template developed yet for your sliding fee scale, but that it can be done here as we go through some of these details. Okay, so my goal is on the next few slides is to share with you, kind of this sample here that we see of a fee schedule analysis. This is something that we might compare to finalizing the worksheet. We'll kind of look at those details. And then we're going to move forward with looking at some examples and what those things mean, and then kind of helping to wrap your head around simplifying those details into maybe a 5-code model sliding fee scale. That's really kind of the goal that we're going for as we're looking through these details. So just hang with me as we talk about this and what we see in the worksheet, because of course we need to finalize our worksheet, right? So as we take a look at these details here, imagine these are kind of those columns in the worksheet as I talk through this next piece. So we can see here our CPT codes. We see the real true Wisconsin Medicare fee schedule rate for these services as an example. Now, this is just, I made up this slide. And so let's say this is just a sample clinic fee schedule. And this is how they have their data set up. And let's talk about some of the things that we're seeing here. So we see their fee schedule, and then we see next to that their charge master. So here are their actual clinic fees. And so what this clinic did is they decided, you know what, we're going to keep this as simple as possible. We don't have a variety of payer mix. You know, maybe they don't even have Medicare patients, but they decide, you know what, we're going to go off of the Medicare fee schedule, which is perfectly fine, because that's where the foundation of our RVUs comes from. And then we're just going to mark it up 120%. That works for some things, but you might be selling yourself short sometimes if this is the approach. So as we take a look at this, we can see our charge master has these fees that are higher than our Medicare fee schedule. So we know that, you know, reimbursement for those will be appropriate and hopefully cover the cost of those services that are being provided, because we set our fees at this 120% of the Medicare fee schedule. Okay, interesting. So then let's take a look at the next column where we have this health plan rate. So let's say, for example, that I am being the clinic contracted with Anthem Blue Cross Blue Shield. Now, these are definitely not their rates. I'm just, you know, speaking for teaching purposes. But let's say these are your rates from your commercial payer according to your contract. We start to look at these rates, and then we start to look at them in comparison to the Medicare fee schedule. And then we start to look at those in comparison to my clinic charge master, you know, and I can definitely tell that I need to revisit those contracts, or that said contract with Anthem or with whomever my payer is that has these very low rates, and start to negotiate or revisit this reimbursement. It is low. We can see that their commercial reimbursement rate is less than, again, your charge master. And so as we take a look at that, and maybe this clinic is analyzing their patient population, their volume to services, these ideas start to come up with a target rate. You know, we're undervaluing what we're doing here by not appropriately capturing the right amount of revenue that it takes to, you know, keep the doors open to provide this service. So let's change our target rate. Now that I know that my commercial payers are way low, and you know, this clinic wants to pick the path of least resistance based on these simple details that I share with you in this training example, and they decide, you know, let's just do 150% of the Medicare fee schedule. So again, we can go back to the worksheet, change a formula, and boom, it automatically calculates your new proposed rates for everything. So we can see how this method makes it very simple to track and update within the worksheet. But we want to make sure that we're analyzing the truth about the clinic, our services, our payer contracts, all of those good details, which is what's going to be reflected here in finalizing, you know, our worksheet. So as we think about you know, finalizing the worksheet, I think I went through, you know, most of those details when we switched over to the oh, what is this? It's an Excel file before. But again, once you have all of these details in place that we went over, you have collected all of your expenses and you've put those into the appropriate expense categories within the spreadsheet. And then again, all of the RVUs, the fee data, your current fees, your service utilization, that frequency of how often you're providing those services. Get those columns all done. And you're probably going to have everything done except for column L. And then that's when, you know, now we've got all of this stuff, and let's take a look at our proposed fee. What do we want to put in here? Are we going to just put in here 150% of the Medicare fee schedule? So we're going to do 150% of that 9782 for my, you know, 11981. Do we want to be a little bit more creative about that? Maybe I have, you know, 30 to 40% commercial payers, and I should probably be considering a little higher rate so that we're not undervaluing that reimbursement. And so again, I think the details that you put into column M and N are significantly going to impact the decisions of your final proposed fees. But so that would be the next step. So then we want to get those proposed fees in here, make that determination. Now we have details in column L. Here is our charge master. These are the fees that we want to move forward with. Okay. So as we think about that, once that's been established, number one, if you have a lot of payers, again, that you may need to go back and negotiate with and say, you know, we definitely need to revisit some of these contracts. And you know, or maybe you want to start up some contracts and start bringing in or providing services to this patient population that falls, you know, within this certain payer mix. So you can see here on this slide, there's some great take homes to think about, depending on, you know, what your next steps are, what your situation is moving forward. But of course, you always want to begin your negotiations early. We know that, especially when it comes to negotiating finances, these things can go back and forth and take some time. Of course, studying your data is, as you can see, there is so much that we can learn about our data. We can learn about, you know, our services, you know, what we've learned here, understanding the value to volume. We can also learn about services that maybe we're not providing, but we're not coding. You know, or are you not coding things because you're on a single rate reimbursement and you say, oh, we don't get paid for it anyway, so it doesn't matter. It does matter. You know, as we take a look at the services that you're providing, that data, the volume of the services that you're providing is analyzed to determine a single rate reimbursement. And so, you know, we definitely want to recognize and understand the value in all of this work that we're doing for this project, what we can do to improve the whole revenue cycle of our organization when we really understand these details. You know, I oftentimes in these types of clinic settings, everyone, of course, is very kind-hearted and cognizant of the financial impact that services have on patients and the struggles that they have. But it's also a business that we need to make sure that is making enough money to support the expenses that are being incurred so that we can continue to keep the doors open to help this patient population. And so I think that the more that we understand these details, the more that we understand our sliding fee scales, and you know, the more that our clinicians recognize the value of what they're doing and coding it correctly and documenting it well. I think there's a lot of value in that, because oftentimes in these settings, I see the clinicians that just undercode everything because their heart goes out to their patients, but they're not appropriately applying the sliding fee scale. We really want to get out of that habit. If it indeed is occurring, we have the sliding fee scale in place to help those patients that are struggling financially. But we also don't want our clinicians undervaluing the complexity of the services. Don't pick a 212 to save the patient money when you're actually offering a 214 service. You know, so those are good things to keep in mind. But as we go back to thinking about negotiating our contracts with payers, you know, as you think about these details and understanding how it impacts your business overall, then you're going to be a lot more knowledgeable about being able to stand your ground. You know, our payers, they want to keep their money. They're going to find 101 ways to deny a claim, and they're going to do whatever they can to negotiate those fees to the lowest rate possible. So the smarter you are about these details, the smarter you are about the value that you're bringing to the patients that they're serving as well, the better off your chances are with negotiations of higher rates. You want to start high, be greedy, you know, really, because they're going to come back in, you know, and keep those things in mind, be persistent with things. And again, if you understand the processes and your value, it's going to make your negotiations that much easier, and you're not going to be intimidated by whatever they may bring to the table to try to decrease those proposed rates. So again, great things to keep in mind as you may be wanting to pursue some contract negotiations. Oftentimes, and I will say, I think that if we're talking about commercial payers, you do not want to negotiate anything less than 150%. Really, that is actually kind of low in the commercial setting. I'm talking about 150% of the Medicare fee schedule. But again, don't undervalue the significance of what you're doing and think, oh, this is the Medicare rate, and use those details to negotiate, because there's opportunity for more revenue if we're smart about it.
And Ginger, I would just bring up as well, when you're building out your charge master, to keep that in mind as well, to be looking at your contracted rates, because if you do have payers where they are paying for a service that's above your, your charge master rate, they're only going to pay up to the amount that you billed. And so you should consistently be looking to see what they're coming in at when you figure out what your charge master percentage looks like as well.
Yes, absolutely. Thank you for that added detail, Sheila. And she couldn't be more right. If you're only charging $120 for a 99203, but you've got commercial payers that'll pay $180 for it, you bill out $120, you're only going to get $120. So again, not to undervalue the significance of the services that you're providing. Oops. Let me go back to this slide, because we are now here at our sliding fee scale. So here we just see some details. The sliding fee scale is available to all patients without insurance and denied coverage under the Family Planning Benefit Program. So you guys are required to have this sliding fee scale. Co-payment or visit deposit is expected at the time of service and when applicable. We definitely want to try to manage and collect those co-pays and out-of-pocket expenses right away. The best time to do that is when the patient comes in for the appointment. As we think about sliding fee scales, you'll see as we go through the next few slides that they are variable, and the prices are adjusted based on the patient's ability to pay. And so as we go through, you'll see with the information that we review how that is calculated and how we determine this patient only has to pay 20% of our charge master rate, where this patient needs to pay 80%. And it's all based on their level of income. And so sliding fee scales must contain, of course, sufficient proportional increments so that the inability to pay is not a barrier to services. So as we look at the federal poverty levels and those types of things that we need to consider when setting these sliding fee scales, it's important that we've got to have sufficient proportional increments. We can code it down to maybe a 5-code model, which we'll take a look at, but we want to be as fair and ethical with the application of our sliding fee as possible to assist our patients with their financial struggles appropriately. It must be developed using a cost analysis of all services for the program. So that we've talked about this in part 1. So, all of your clinician services, all of your supplies, your laboratory services, all of those things that we talked about that are an expense to your family planning program. Now, this makes me think of a question that I had. I'm going to bring up, but I honestly can't answer it 100% without more detail. But remember when we talked about in part 1, where we might need to start to break down an employee's time because they are putting time into another program, but they're also part of your Title X program. So we got to figure out the percentage of time that they're spending in Title X program in order to calculate their expenses. I had a question, and we'll put it in the FAQs and follow up with it, but there was a question about having a staff member that was providing these services, but they weren't an expense to the program. And I think, oh, okay, I have more questions. Maybe this could be considered, I don't know if it's a donation, an in-kind contribution, or maybe this is an expense, it's being expensed in another department that really should be broken out. What are the details of that? Just because it's like a volunteer. If a volunteer comes into your organization, you can still count that kind of as an expense if they're providing a service that still needed to be provided, whether or not you paid somebody to do it. And so it's kind of hard finding that fine line, but think about those things when you're looking at your expenses. And, you know, don't just undervalue some of those questions you might have and not include them, because they very well may be appropriate to represent in your expenses, which can impact the overall results. So you might get into some of those details as you're going through your cost setting activities where you're like, I'm not really sure. And so keep those things in mind as you are starting to work on your cost setting activities. Jot down your questions again and have that stuff ready when you get ready to sit down and have that TA with Sheila, and you can go over maybe some of those more specific details that are unique to your situation. Okay, and then I shared some of the sliding fee scale requirements on the last slide with what I was stating, but we can see here that, of course, you have to perform this every 3 years as part of your family planning program. I'm definitely going to recommend that you guys do some of these activities every year. And as we get to the end of this, I think that you'll see why. So just some great things to keep in mind as we see the requirements here. So this slide shares with us the current federal poverty guidelines that should be considered when creating your sliding fee scale. This is for the state of Wisconsin. This is the current 2021 data that was released in February, and you can access it right here on this link that we shared on this slide. Now on the next slide, oops, wrong button here, hold on. On the next slide, we're going to start to see this sliding fee schedule, and I'm going to go through the next few slides and start to make sense of this as we break it down a little. So stick with me as we look at this slide. Now, we can see some of this information is relating those numbers maybe off of the federal poverty levels that we see. And what did I say? I think this is a 10 model slide that we're looking at here. So a lot of wiggle room here. It actually is very comprehensive and detailed in that fashion where they've really got it broken down in these individual poverty guideline levels. So just stick with me as we take a look at this. So in the first column, in the second column, you can see that the patients that fall within these federal poverty levels are going to have 100% slide. So we can see this 100% slide here. And we can see the poverty level that's in association with that up here at the top. Now, as we move over to the next column, of course, we have 100% slide. As we look at the next column, at this family side, it shows 90%, right? So that patient that falls within this category, as we look at this data, is only going to have to pay 10% of the charge master fee. Okay, so keep that in mind. And then you can see as we go down, that sliding fee continues to, the fee actually is higher as we continue to see that their income also is higher. So as we look at the end here, if they're over the 200% of the federal poverty level in the state of Wisconsin, they're not getting any slide. You're not getting any credit. You're going to have to pay our whole charge master fee. But if they are at the 200% according to this schedule, then they're going to pay 90% of that fee. So that is how this works. So you can see that it's very comprehensive on the level of having multiple models. Now let's break this down and simplify it a little bit so that we can actually work with some of this data. So here in this example, it's kind of the same thing, a lot more simple, but we've taken a 5-code model. So you'll see, let me go back just a slide and explain this to you. Like this first column here where we have 100% and 110%. What if we combined those two and all of those patients slide to 0, right? What if we combine the next two columns, the 90 to 80%, and all of those patients pay 20%? Then it goes on and on. Okay, so that's kind of what I'm thinking about as I'm looking at the federal poverty levels, and then how do I simplify my sliding fee scale to work for me, okay, where we're still using good, accurate information and coming out with ethical slides. Okay, so back to the 5-code model. So based on what I just shared with you in that simple example, we were kind of combining some of those details. You can see that if they are level 1, then they pay 0. You know, they have 100% slide, right? What if they are at this level 2, right? How are we identifying that? That's based on that federal poverty level. Everyone that's in a level 2, they pay 25% of our fee. Everyone's a level 3 pays 50% of our fee, and so on. So I think it's pretty self-explanatory here, where we can see even in this particular model, we've got folks that are at 200 to 250% above the federal poverty level, but they still get a little bit of a discount. You can see they're getting a 25% discount here because they only have to pay 75% of our charge master fee. So this is a much more simplified format. Let's take a look here at this next sample as we think about this 5-code model that I just shared with you. So here we can see someone's actual sliding scale. What's cool about this is they have the federal poverty guidelines right here in their display, so you can kind of see that. Now in your final scale, that's not a requirement to have the federally poverty level included in the display, but it's definitely important to include it in your formula, right? So keep that in mind. I think that comment will make more sense on the next slide. But as we look at these, you can see we now have this 5-code model where they're either a level 1 where they pay 0%, they're a level 2 where they pay 25%, they're a level 3 where they pay 50%, you know, 4 they pay 75%, and if they're a level 5, you just pay our fees. And so this is how we've set up our fee schedule. And then maybe this clinic's providing some large services, they have some device expenses, those types of things that you still need to capture reimbursement for. You're not getting additional reimbursement for these things if they are, this is interesting. What if they're donated to you? What if there's something that you usually would buy, but they were donated to you from some kind person? Wouldn't that be great? Still an expense, right? Because there's services that you wouldn't have needed, but it was a donation. So that's kind of just taking that to the next level. But again, think about these supplies that are real expenses to your program. How are you going to get reimbursed for those things? So we can see that here. Now let's take a look at the next slide. This next slide kind of takes everything that I've shared with you in the sliding fee scale samples and put it here kind of nicely in more of a clinically appropriate setting. Now, this is an example of a clinic that set up their sliding fee scales. I believe that this is set up on 2020 reimbursement rates. And you can see here, this is the perfect example of what to submit for your proposed sliding fee scale. So this is going to be that document that you create in the workbook, and that extra tab that you're going to keep and say, here is our charge master. You know, here are the codes that we charge. Here's our sliding fee scale. This needs to be submitted at the end of this project. This is the final goal, right? This is kind of the answer to the problem, but the workbook and the summary report are kind of like, show us your work. So keep that in mind. This is the goal. So we can see here, this clinic decided to go ahead and separate their charge master out by office visits versus annual exams versus individual counseling. They also decided to do a slide based on percentages. And as you can see, if you've got a good workbook in place, this makes life so much easier when you go in to adjust your fees, because you just got to plug in the data. When we start to do it more on a copay type thing where it's like 5, 10, you know, that might be a little bit different, but just keep those things in mind. You can do it however you want. Just explain your reasoning in the summary. Okay, so as we take a look at this sliding fee schedule sample, you can see we've got our office visit services here. That our full fee is what we would have seen in our workbook as that proposed fee. So this is where we want to update our charge master to based on this entire analysis. And then we see that 5-code slide right? And so I like the way that this organization did it, and they put code 5 at the beginning of this. Quick reference, of course, your code 1s are all slide to 0, right? But this patient's a level 5, and so, you know, maybe we're going to give them a little bit of a discount. I'm kind of wondering about their percentages that they have here in conjunction with that. But I think that this display makes good sense as we can start to see how that all comes into play. This group sorted out their counseling between their individual annual exams. You can set this up however you want. But again, the end goal is to submit your sliding fee scale. Here are all the services we provide. Here's our charge master, and this is our sliding fee scale. Then you're going to submit that report, your workbook with that says, this is how we did it. This is how we came up with what we're going to implement for our charge master and sliding fees within our organization. So really that is, you know, conducting your cost setting analysis in a nutshell. I feel like we've had a lot of information to go over in 3 hours, and there's obviously definitely going to be a need for that training assistance for many of you as you work through these things. But I think that there's just a lot of detail to it, but once you get all the pieces in their right place and start to wrap your head around what the data is telling you, it just starts to make good sense. So now you guys are going to be moving on and being tasked with conducting all of these fun activities that I've shared with you. Think about collecting all of your questions and all of those great things that you want to talk to Sheila about during your 1 hour training or your assistance, your calls with her. And then remember, we will also be completing Title 10 manual for you guys. So that gives you all something to look forward to having at the first of the year. So there are a lot of things as part of this project that you will see supporting your service line and what we're doing here. So as we take a look at this next slide, great reminders here. Like I said, you know, before, it might seem like a little overwhelming, but really we just need to get all these details together. You do have some freedom to develop your fee schedule the way that you want. You can see we have a lot of things to consider as you're analyzing those proposed rates. And then, of course, really want you to recognize, understand, and utilize the resources that really help to ease this process, the importance of doing these things. It's not just because the state says so every 3 years, but really you want to be updating your fees annually. If you have someone that can go in and update those RVUs and revisit some of these fees at the first of the year, that's awesome. You're on track. You can update the cost of living adjustment. You've got this wonderful workbook that you can just track those details in. So remember, there's so much value into doing it more frequently. And then when your cost setting is due again in 3 years, you've already got it dialed. You've been doing it. You recognize the details. You're even better at it now than you were now, right? So just keep those things in mind. And then, you know, you can see this bullet point here, review your contracts and fee schedules at least every 2 to 3 years. But I think if you're using this tool and you go in and put in this data and just keep tracking this, it would be pretty easy to revisit those contracts every year. Why not? You know, our payers are revisiting your claims every second they get. So I think it's a great negotiation tactic. And then, of course, you want to recognize what you're documenting and what you're reporting. We've seen in the display, I believe, was it last week that we talked about the impact that inappropriate coding can have on your fees and recognizing the value of your services. Do not undervalue the significance of what you guys are providing to the community by undercoding because of patient out-of-pocket problems. That's what our sliding fee schedule is there to do, is to help us with that. And then this activity is there to help you guys assure that you're still receiving enough revenue to provide those services. Okay, so now on these next few slides, I'm not going to read through these. I'm just going to kind of share these and click through them as I talk, but I just want you to know that, again, we're collecting all of the FAQs that are in relationship to this unique project. Sheila's going to be making an FAQ sheet, you know, at the end of this project, after she has time to meet with you guys and, you know, go through all of your proposed rates and, you know, get that all taken care of. there's going to be so much more that we know about the subrecipients in the state of Wisconsin, that we're going to have a lot more FAQs to answer and to share with you at the end of this project, so that everybody just has a much clearer understanding of all of these great details as we move forward. So here is my contact information slide. You can see on this slide that, of course, we have Catherine's information there to reach out to in relationship to this project, as well as Sheila. Her email address is right there to contact for that training assistance that you may need as you go through this cost setting project. Feel free, and Sheila, please, correct me if I'm mistaken, but feel free to directly reach out to Sheila to propose a time to meet to go over your analysis. And I will say that in the past, what I've done with some clinics is sometimes maybe we just need a half an hour of time together to begin with. They don't even know where to start. Let's just dive in here together. Let's take a look at the workbook. Let me give you some guidance. And then they're like, oh, okay, the light bulb clicks and they're on their way. And then when they're done, they might want to meet up and say, hey, can we just kind of go over a couple of these things? That's okay too. We want to make sure that the activities and the process that we go through is helpful to you, that it's educational, and that we're just providing the service that you need to complete a good quality product. So again, keep those things in mind as you're reaching out to Sheila for assistance.
Yeah, absolutely. Feel free to send me an email and I will glad to reach out and schedule time with you.
And thank you so much. This concludes part 3 of this 3-part webinar series on cost setting analysis. It's been my pleasure to work with you guys and deliver this information to you. The last slide includes many references that we utilize in gathering these details to share with you. So again, be sure to reach out to those references for any assistance that may be helpful there. And again, I would like to thank everyone for their time today, and I hope that everyone has a fantastic Wednesday.
I don't see any Q&A in so far.
I see some chat. Let's see here.
There was one about getting larger slides, and they're going to provide that, but that's the only one so far, I think.
Yep, that is all I see as well. And we'll give it a few minutes. We still have some time left in this webinar, so we will stay here until 1. But thank you, Ginger, for the past 3 webinars. It's been extremely helpful, I know. And as we wait for those questions to roll in, I do want to remind everybody that all 3 of the webinars are recorded, and they will be available on our website, which should be located on the thank you email that you will receive after this webinar concludes. And just to note, the webinar, so specifically this one, will not be uploaded immediately. It will take a couple of days, no later than a week, should it be uploaded to the website. So just be aware of that.
Thank you, Megan. I'm looking through some of these questions, and that there's one thing that it looks like a lot of folks are asking for a larger format. We do have some references listed on these slides that maybe they're not being able to read in the three slide handout format. And so that might be helpful. And then it looks like there's a question about the second session had the spreadsheets too. And I wonder if they had a PDF of maybe a 2-slide per page where they could read those details a little bit better. And then in relationship to that second session that had the spreadsheets, I know they're hard to read on the handout. So if they had a handout that had bigger slides and they use that in comparison in conjunction with utilizing the Excel workbook while they have that open, that might help to answer some of the questions that you had about what you're trying to read on the spreadsheets. So let me know if that's going to be helpful. And Megan, is that something that can be provided to the group?
Yep, I can do that and include it in the follow-up email after this webinar concludes.
Okay, perfect. You know, I'm not surprised we don't have a lot of questions right now, because if folks haven't started conducting their activities yet, they don't really know what they don't know and what to ask. But this is a great time where they're starting to wrap their head around, okay, now it's my turn to go and start this work and start to collect your questions as they arise, because that's when you'll probably have the most questions, when you're actively doing those activities. And I suspect that even if you need, and Sheila, again, correct me if I'm mistaken, I'm speaking for you, but if there's a quick little question you need just to get you going, you don't necessarily need to have a meeting. You could shoot Sheila an email for some direction. And then
Yes,
she
absolutely.
can determine, yeah, whether or not you need to schedule a meeting. But know that we're here to assist you. Sheila's happy to answer any questions that you may have as you try to wrap your head around all these details.
Yep, definitely.
It looks like there is a Survey Monkey for everyone. Your feedback is greatly appreciated. Sheila Haynes, I have a question. Who is Sheila and what is her contact information? Let me go back a slide because it looks like you can't see this information on the handouts. And so you'll get that updated handout where you should be able to see it. And you see Sheila Haynes' email here as Shaynes, SHAYNES at rtwelter.com. Sheila is the new coding and compliance manager for RT Welter and Associates. She is my replacement.
Yeah, so just like Ginger said, feel free to reach out to me. We have very similar, backgrounds. I have about 30 years of experience in revenue cycle management and coding and compliance. So hopefully get to know each of you very well through the training and whatever questions you might have. But yes, please feel free to reach out to me at any time.
Thank you, Sheila. You're always a pleasure to work with.
Yeah, you as well. Thank you.
I think we'll remain on the line a couple more minutes until noon. If there's any other questions, feel free to take your time now to kind of throw those in the chat. Anything we can be of assistance with, we're happy to help.
All right, as we hit one, I just want to thank you again, Ginger and Sheila, for all your hard work on these past 3 webinars in the series. And thank you to everybody who joined and participated. And please look out for that follow-up email, which will include all the information you need to know, as well as evaluations. Like we said, your feedback is greatly appreciated here at HCET. And you can find all of the recordings on our website, along with any other information you need for these webinar series parts. So with that being said, I hope you all have a great rest of your day.
Thanks, Megan.